Hospitals in this country are being stretched to their limits, largely due to a rise in respiratory infections. Joining us live now is infectious disease specialist Dr. Isaac Bogosh, who joins us with a broader look at the healthcare system during this time. Good morning to you. Great to see you, Dr. Bogosh. A number of respiratory viruses circulating in the country right now. What are we seeing? What's going on?
Yeah, we are in respiratory virus season. There's a lot of respiratory viruses circulating. Obviously, we've been talking about COVID for the last 2.5 years, and we cannot ignore COVID-19. But unfortunately, there's other respiratory viruses making a resurgence. We're seeing a lot of respiratory syncytial virus, that's also known as RSV. And we're really starting to see a pretty impressive and rapid rise of influenza, the flu. And that's having an impact as well. And then there's, a list of respiratory viruses that are longer than my arm that are also circulating as well this time of year. So, unfortunately, we're in a position where the healthcare system was already stretched even before respiratory virus season began. And this is putting additional pressures on an already stretched system.
Right. And how does this season compare with other seasons?
It's worse. And I'm not counting 2019 and 2020, when we saw very little in the way of other respiratory viruses beyond COVID-19. When you look back at data from Canada between 2014 to 2019, for example, we're seeing a sharper and earlier rise in respiratory illnesses now versus those years. So, what people who are listening and watching might say and might be thinking, wow, everyone I know seems to be sick, or my kids seem to have the sniffles or have a terrible cough. That's actually backed up by data. The data really does show that we are seeing an earlier and sharper rise in these respiratory illnesses now compared to prior years. Yeah,
it does really feel like everybody knows somebody who's sick right now. What can we do to ease the burden on the healthcare system to prevent ourselves and our family members from getting sick?
There's some very simple steps we can take that hopefully aren't news, hopefully isn't news to anybody. Number one, we have free and widely available vaccines out there for COVID-19 and for influenza. It's a great idea to be vaccinated for those. Number two, listen, we've been wearing masks intermittently over the last 2.5 years. Of course, we know masks aren't perfect, but it'll lower the risk of someone getting an infection, especially in an indoor environment. And if someone is sick, it'll reduce the risk of someone transmitting the infection to others. The third thing is staying home when you're sick. Just stay home when you're sick. I know it's easier said than done, but it really is important to stay home if you're sick. It doesn't matter if it's influenza, if it's COVID, whatever, stay home if you're sick. So those are, 3 key tips. And the other one that, is also really important is I wouldn't neglect hand hygiene. Okay, we know COVID, for example, is primarily transmitted through the air between people in indoor environments, but there's other viruses out there that can be transmitted through contact. And I don't think we should forget about those as well. So hand hygiene is also important.
Some really important reminders for sure. I want to talk about the kids for a moment, because a lot of children are seeing respiratory viruses. That has a lot of parents concerned. Any advice there?
This is a tough time. And again, we can still vaccinate for other vaccine preventable illnesses. We can isolate our children at home if they're sick. For example, isolate might be the wrong word, but keep our kids at home if they're sick so they don't go and infect a classroom or others at their extracurricular activities. And again, you can reduce the risk of infection with masking. You can. It's not perfect, but it does reduce the risk of infection. And, in the absence of mandates, parents can choose to do this. And it's just something that we should be enabling people to make informed decisions in the absence of mandates.
Right. Do you think we're seeing more kids sick right now because they weren't exposed to as many viruses at the beginning of the pandemic?
Yeah, that's a great question. And quite frankly, I think there is some debate as to why we're seeing this now. And one theory is, there wasn't the same degree of exposure, not just to RSV, but to a lot of other viruses. And I'm not saying it's good for kids to get infected. It obviously isn't. We don't want anyone to get infected. But the immune systems might be, for lack of a better word, more naive. And you've got a lot of susceptible people infected at the same time. So that might be one reason. But again, I caution that we don't have a good answer to this. The other uncertain area is, does COVID itself influence the immune system and make people a little more susceptible to these illnesses. And I can't stress this enough. I don't think there's a clear answer right now, but obviously we do know what we can do to protect ourselves from these infections. We can be vaccinated, we can put on a mask, we can wash our hands, we can keep people home when they're ill so they don't infect others. So regardless of what's driving it, we do have solutions to this.
Yeah, we know what to do at this point. Okay, Dr. Isaac Bogosh, as always, we so appreciate your insights. Thanks for joining us.